Okay, hello everyone. Welcome to the University of Illinois at Chicago's live webinar for the online Health Informatics and Health Information Management programs here at the UIC College of Applied Health Sciences. My name is Dana Hopkins and I'm an enrollment specialist for the programs along with Curtis Adams, and I will serve as the moderator for today's webinar event. Thank you all for joining us today. If you just jumped on, we've been asking people to just put in the chat where you're from, your name, which program you're interested in, and how you got interested in that program, please. A few housekeeping items before we begin today's presentation. You're welcome to keep your camera on. However, feel free to turn your camera off if you're having connectivity issues. Please keep your mics muted during the presentation. We will have the chat box available for you to enter questions. We do recommend closing other browsers or applications during the presentation to prevent the webinar from running slow or freezing. As I said earlier, we are recording today's session, so feel free to take notes if you'd like, but keep in mind we'll be sending out a link of the recording of the full presentation to each participant. And please feel free to share with other colleagues or friends who you think might be interested in the programs. If you have a question come to mind during the presentation, feel free to type it into the chat and we'll address it along with any other questions during the Q&A session for the final 15 to 20 minutes of our scheduled time. All right, now I would like to formally introduce today's agenda. We will begin with a program overview with our program directors, Dr. Miriam Isola and Professor Karen Patina. We will then move on to student experience with 3 HI and HI alumni, followed by a short Q&A with the alumni. We'll then have a financial aid overview by UIC Office of Financial Aid Assistant Director, Bianca Sanchez. And then at the end, we'll open up for Q&A just from the alumni, or if you have questions for Bianca or for Miriam or Karen. Again, please feel free to introduce yourself during this portion of the event. All right, at this time, I will go ahead and turn the portion of this session over to Dr. Miriam Isola, who is the Clinical Assistant Professor and Director of the Health Informatics Programs, and Professor Karen Patina, Clinical Associate Professor and Director of the Health Information Management Programs. Dr. Isola's background includes over 30 years of experience in healthcare information technology, operations, and education. In addition to her teaching at UIC, she advises health systems, hospitals, academic medical centers, and accountable care organizations. And then Professor Patina worked in hospital medical record department management, as well as in systems planning and implementation, and served as a member of the Cerner implementation team at UIC. Professor Patina has received numerous awards for teaching excellence, and she's active in HIM professional associations at the national, state, and local levels. Miriam, I will turn it over to you. Enjoy the presentation, everyone.
Thank you, Dana. Good afternoon, everyone. It's good to have everybody on the webinar. Can everybody hear me all right? Okay. I'm just going to talk for a few minutes about the program itself, some of the features of our program, and then some of the benefits for you to think about when you're choosing the program that's going to be right for you. Can you move to the next slide, Dana? There you go. Okay. So what you can see on this slide, some of the key features of our program. First of all, it's 100% online, and it's online and asynchronous. So this allows students to work on assignments at their convenience as their schedule allows, considering their work or family obligations. A common question that we often get is, how long does it take to finish the master's program? As you can see, we have 9 required courses and 38 credit hours to complete the program, but it all depends if you're taking full-time or part-time courses. So if you take 2 courses each semester, you can usually finish the program within about 2.5 years. Students come from around the United States and around the world even to our program. UIC is a recognized university for having diversity amongst the student body, and this is true also for our Masters of Science in Health Informatics. The faculty in our program are involved in both research and actively practicing in the field. So we have a combination of that. We have 12 part-time and full-time faculty, and then some additional adjunct faculty that also teach in the program. So it's a good variety and a lot of resources for students and experts in the field. The program focuses on providing you, the student, with advanced skills. Health informatics is a growing field, and the focus of our program is to prepare you to be successful in the workforce. So students can become successful coming from a variety of different backgrounds. We have students from clinical backgrounds or technical backgrounds.
No, fine for me. Yeah, because
All of them can be successful in the program. And as you can see, we don't require a standardized test, no GRE or GMAT to apply to the program. So that's some of the basics about the program. As far as some of the benefits to you and why you might want to choose UIC to get your health informatics degree. The top 2 points that you see there are the number one things that students often say when they say why they picked UIC. 1, it is an online program, so they had flexibility. 2, it is an established reputation that we're an accredited program. So those 2 things have been said by many students as being their reasons for choosing UIC. We've been an established program since 1999, and we were accredited back in 2010. We were the first accredited program in health informatics. So we've been doing this for a long time. We have an established reputation, and we know how to do online education. The approach to our program, every program is a little bit different in what they emphasize. Our program is emphasizing social informatics. So we look at things like population health, consumer health informatics. Other programs may focus more on things like genomics. And so for this program, we tend to focus more at the population level. The curriculum reflects current industry trends. So even though we've been around for a long time, our curriculum is updated so that it is relevant to you and to what's going on now in the health informatics field. And the job opportunities for graduates of the program, if you look at the bottom of the slide, you can see some examples of jobs and potential salaries. There are many opportunities in health informatics. You might work at a traditional type of job in a hospital or a clinic or a big healthcare system, or you might work in something a little less traditional or something you might not think of right away, such as the pharmaceutical industry, healthcare software vendor, or consulting. There are a lot of different opportunities. And today we're even seeing that non-healthcare companies such as Google or Microsoft or Amazon are hiring people with health informatics backgrounds now. They're starting to work in the healthcare space too. So these are some things that could be benefits to you and something to consider. And the last thing that I'll mention is what I think is a very big key differentiator for our program, and it could matter to you. UIC is one of the largest programs of its kind. We have over 350 current students in the program and over 1,000 graduates of the program. So these people are your peers and they become your professional network when you graduate. If you're involved in a small program, this doesn't happen. So this I think is a key benefit to students compared to a smaller type of program. So those are just the highlights about our program, and I'll turn it back over to Dana.
Thank you so much, Miriam. All right, now we are going to move on to Professor Karen Patina.
Thanks, Dana. Again, do you want to move on to the next slide, please?
Yes.
Great. Well, good afternoon, everybody. I'm going to start out by telling you, I think, what health information management is all about. We have a lot of the same advantages of our program as Miriam mentioned, including, you know, that it is all online, doesn't require the GRE and GMAT for our master's degree, and so forth. So I instead will concentrate on what this field is all about, because it's not well known. It's an area where professionals work with patient data and the processes for collecting, analyzing, and protecting it. And the data can be used in patient care, reimbursement, or for many other purposes. It's a great career choice if you want to work in healthcare, but not directly with patients, which we're hearing a lot these days. And demand for HIM professionals is expected to grow more than average for at least the next 10 years. You can work in a variety of settings, in a number of diverse roles, whether you like working with technology, data analysis, maybe you like the legal side of healthcare, privacy and security, finance and reimbursement, coding is part of health information management, or just general management. You can work in a traditional hospital, you can work for vendors, you can work for insurance companies, health departments, a variety of different places. And I think that's what makes this field very interesting, because you can graduate with a degree and end up doing so many different things. Our HIM program is offered either as a bachelor's or a master's degree. And one of the things that is really good to know is that we're one of the few careers that you can do very well with just a bachelor's degree. You can work, within a couple of years of starting, make close to $100,000 as far as salary, and you can work in a variety of different places. So it's a very intriguing kind of degree. We also offer our master's degree. So I'll tell you a little bit about the differences between the two. The bachelor's degree was established on campus in 1965. So again, we have a very long history with this. It was added in an online format in 2012. And just out yesterday, we're very proud to say that our online bachelor's degree, along with 2 other degrees at UIC, was ranked #3 in the nation by US News and World Report. We're very proud of that. We've been ranked in the top 5 for several years. So we have to give a shout out to ourselves and a pat on the back for that. Completion of the degree permits you to sit for the Registered Health Information Administrator exam. It's also known for short as the RHIA credential exam. It's a national exam, and students can sit for it while they're completing the degree in the last term. Our master's degree is our newest degree. It's designed for those who have a bachelor's degree in another field, and that can be anything. It can be clinical, it can be technical, it can be business, it can be history. It's designed for those who want to transition to HIM and they want to do a master's degree as an alternative to a second bachelor's degree. The master's degree enrolled its first students in fall of 2020, and we are in candidacy now for KHIM accreditation. A program has to be, an HIM program has to be accredited by KHIM in order to have its graduates sit for the RHIA exam. So our bachelor's degree has been fully accredited for a very long time, and just within the last year was resurveyed and reaccredited, and we got a perfect score on our curriculum, something that is relatively unheard of. So again, we're very proud of our quality program. Now, that being said, the master's degree in candidacy, it's because it takes a while to grant accreditation. The program has to exist, has to have students. And so we're going through the process now. We anticipate it will be complete this year, and we really have no doubt that the program is going to be accredited based on the strong history that I just gave you of our bachelor's degree. Once it becomes fully KHIM accredited, then these graduates can also sit for the RHIA exam. And even those who were enrolled first before it became accredited will be grandfathered in and permitted to sit for the exam. So that, I think, gives you kind of a flavor of what HIM is about and what our degrees do for you. So I'd like to turn it back over to Dana at this point, and I look forward to any questions that you might have later.
Great, thank you so much, Karen. All right, now we are going to move on to our alumni panel. Today we have Sarita, Matt, and Ishrath. Sarita, if you would like to start by introducing yourself, and then we'll move on to Matt and Ishrath, and then we'll get to our questions for them. Did we lose Sarita?
I'm here. Sorry.
Oh, okay. Oh, we're muted again.
I'm here. Can you hear me?
Okay, yes, thank you.
Yeah, you had the host privileges. Hello, everyone. Glad to be here. I'm Sarita Kennard, born and raised in Illinois. I now reside in Washington State, so I've been here about 7 years now. I have a bachelor's in HIM, which Karen just talked about, and then I also have my master's in health informatics, because the master's in HIM wasn't available when I was looking for the master's program. I'm happy to be a UIC alum. I definitely learned a lot with my experience there and great connections. My family has a lot of healthcare background. So when I came to UIC, I started out with pre-med and shortly realized that wasn't where I was going to end up with the science and math courses. So I needed to pivot to a different skill. And then I heard about the HIM, which gave me kind of the healthcare business background, which I was very interested in. So I have a history with insurance companies. I've worked at Blue Cross Blue Shield of Illinois, which I actually got from being a UIC graduate and doing my practicum right in my senior year. So I was hired a few months after that. When I came to Washington State, I was in a nonprofit public population health company that worked for Medicaid and Medicare agencies. And then now I'm at United Healthcare. So I am grateful for my UIC experience and connections, and also securing my first job because of the experience I had.
Great, thank you, Sarita. Matt, do you want to go next? And hopefully you can, I changed it so that you can, okay, good.
Hi, everyone. My name is Matt Mikulik. I am a health information management alumni of class of 2018, and I went directly into the Masters of Health Informatics program right after I graduated in 2020. My current role is a analytics consultant at Blue Cross Blue Shield. Blue Cross Blue Shield of Illinois, we manage Illinois, Montana, Oklahoma, New Mexico, and I think it's at them all, Texas. I work with a lot of different portfolio managers, providing analytics and data information about different plans and membership information, a lot of cost sharing information. They come to our team and ask for these reports. And I'm grateful for the health informatics program, especially. It really helped me provide skill set to provide this information and understanding users' needs. How I got started with the health information management program, like Karen, I think said, I wanted to go into healthcare, but definitely did not want to work with patients. I'm a big tech person. I love working with technology, data, and that health information management seemed like the right intersection between that healthcare, business, data information. And then the health informatics program just kind of expanded on that data sector and just going deeper into that, which I definitely enjoyed. Directly out of my health informatics program, I worked at a company called Covance. They were just recently acquired by LabCorp, if you're familiar with drug testing or any pharmaceutical clinical trials. I kind of was like a consultant for them in working with major pharmaceutical companies such as Pfizer and Moderna and stuff like that. They would come to me and our team to get information and data reports on their clinical trials. And then we get to publish all that information for them. So yeah.
Great, thank you, Matt. And last but not least, Ishrath.
Hi everyone. My name is Ishrath and I live in the northwest suburbs of Illinois. I just wanted to introduce myself as a MSHI graduate. I graduated recently in 2021 December. I feel extremely lucky that I got an opportunity to complete my master's at UIC. I am a clinician by profession. I'm a physician from India. I completed my medical graduation like back in India, and then I migrated here when my family moved here from the Middle East. I never thought that I would be stepping into the HIT side. I mean, my family was more focused on the clinical side, and they wanted me to pursue the clinical aspect. But I think I was kind of like more inclined towards the other aspect of practicing medicine as well, and which I always thought that IT plays a big role in healthcare. And health informatics literally happened by chance to me. I currently work as a senior administrator at a healthcare facility in Illinois. And I'm hoping that with my education at UIC, I'll be able to progress successfully in my career as in health informatics. Like currently, like I mean, I manage I manage the administrative aspect of the facility and the daily operations of the center. I collaborate a lot with insurance companies and labs regarding the billing and coding data. And because of my experience, I mean, I have that edge of understanding the clinical documentation as well as the aspect of the coding which goes along with it. So I feel that having a clinical background gives you the perspective of understanding why data is being coded the way it is, and it helps in further enhancing patient services or even the processes of any healthcare facility. So like previously when I worked at a hospital in the Middle East as my previous in my previous role as an inpatient head of inpatient operations, I actually worked with a team of SAP professionals. They were also HIT consultants, and some of them were like dentists from India. They completed the informatics program from New York, and they were trained by SAP, and they were actually trying to implement the HIT at the hospital. And I was fascinated by the way they were kind of like, they knew the clinical aspect, and then they were also so expert in the on the HIT side. And that actually got me totally interested in informatics. And I thought like, okay, I mean, I really like this field and I enjoyed working with them as a team. And I thought like, why there was like a degree which I would go back to when I move back to US, I would definitely pursue that degree. I was researching online and I saw the whole thing about UIC offering the MSHI program. And it did not have it did not have an entrance exam to it, and it was available online. And I thought like, okay, this is the this is the best opportunity for me, and I should take the step. So I feel that with my current role and with my past experience in terms of education and the work experience which I had, health informatics has been a good investment for myself, and especially for clinicians, I think who see that gap in the practice, like between like seeing patients and then managing the healthcare systems. I think this would really be like a good piece for them to kind of like study and then invest their education in. So yeah, I mean that's all about me. And then I think I can talk about another something else on the next slide.
Thank you so much, Ishra.
Sure.
All right, I'm going to move on to our first question. The three of you kind of already went over, so I'm just going to skip to our second one. And we will start with Sarita. How did you become interested in the health informatics or information management field?
Yeah, no problem. So the HIM field, as I alluded to, I started out with pre-med. I didn't want to change schools. So I kind of did the novice thing of looking through the catalog. At the time, it was a paper catalog to see what other healthcare opportunities there were, because I knew I wanted to stay in healthcare. So I found out about HIM and had the fortunate goal of meeting with Karen, and she has such passion about the field that I was like, oh yeah, that sounds great. I got to do that. So she was really passionate. When I had what is the program kind of info session even before switching my major after my freshman year. So that passion fueled me to do it and change my course, which was very great for me. It actually took me 10 years between degrees to get the master's in health informatics. I thought with my bachelor's, oh, I'm good. I can do fine. I'm, progressed in different areas within Blue Cross. So I was thinking I was fine. Then there was a thing called the Affordable Care Act. So I was in an insurance company, and at the time, the thing was about that there could be just a one payer or one unified health system, which would kind of eliminate health insurance. I was like, well, I need a plan B. So what would my plan B be? I hadn't worked in a hospital outside of my undergrad schooling. So I was like, well, I need to at least have some kind of hospital experience or be able to show that I can do that if I needed to pivot into another environment. So the health informatics program actually spoke to that and gave me my next level from that information and let me get more into technology, project management, and other things. So that's how I became interested, kind of pivoted between the two of trying to see what to do and plan for the next phase. And both have given me a rewarding experience and opportunities.
Great. Thank you, Sarita. Matt, do you want to just briefly say what got you interested in the field?
Yeah, sure. So I think, like I said before, I wanted to go into healthcare. I didn't want to work directly with patients. I initially started out my undergrad in pre-pharmacy. So I started getting a bachelor's in biochemistry, which was very interesting. But as I got deeper into the program, I figured out that this definitely wasn't for me. And luckily, I met a friend or somewhere on campus at UIC that was in the HIM program and told me about it. And everything that he said about it was just the perfect intersection of yes, this is healthcare. I get to work with data, which I really enjoyed. And it's also very much like a business management type of setting as well. So I kind of pivoted from pre-pharmacy to health information management, which was kind of like a big deal. I was almost done with biochemistry, but I knew that it just definitely wasn't the right choice for me. So I kind of pushed me back about a year and a half of graduating, but I'm very happy with the decision that I made. I think it was the right choice, and in the long run, a year is really nothing. And then just being in the health information management field, I learned about the health information management program. I learned about the health informatics master's program, which further just was a great interest to me. And I knew that I wanted to go right into that. And I knew that if I took any years off of schooling that I would not want to come back. So I dove right into it after I graduated just to keep my brain in that schooling mode.
Great. Thank you, Matt. Way to get it done. And then Ishrath, if you want to briefly answer this question, how did you get interested in the field?
So as I was mentioning earlier, I was working with a team of SAP professionals, who also had a clinical background. And I was really amazed with how they were able to understand, to learn, and they were able to do all their work within the IT side and work with the HIT systems and everything. So that got me interested. And then I was researching about it online, and I wanted to pursue an online program because I had to take care of my kids as well. So when I moved back to the US, I was researching on UIC especially. I was really keen on UIC because my brothers graduated from UIC. And it was closer to home, and I thought an online program would be the best option. And fortunately this came along, and everything just fell in place. So I think, the initial process of getting information and getting my previous degree accredited, and getting the whole accreditation process for everything for my degree and everything from back home, it was easier. It was easy to communicate with the advisor, and I think that all just fell in place gradually. And then I was also so interested in learning about the whole program that it just fueled the process. So I think, my previous experience from my previous workplace, it definitely guided me towards where I am now.
Thanks, Ishra.
Yeah.
All right, next question. How did what you learned in the program help you in your current job and career progression? Matt, do you want to start with this one?
So health information management really gives you the in and outs of like how data flows and how information works within the healthcare field. The legalities, all of the compliance that goes into healthcare data that like if you go to a hospital, like the patient never really sees like what goes on behind the scenes besides signing all of these HIPAA forms and consent forms that no one kind of reads. But like everything about that is super important because it's your healthcare information. And it's really important now working at like Blue Cross where like all of that information is still like bound, like protected by HIPAA laws, protected by compliance. Fortunately for me, I don't work too much with actual patient data, but everywhere you're talking to people, like it's all protected. It's all, you know, just like something that's going on in the back of your mind. With the health informatics program, some things that really helped with me were learning about data visualizations. That's kind of like a really great interest and specialty of mine that I very much enjoy. These are like visualizations and data points that managers and supervisors and the higher ups will actually use to make strategic decisions. And the important part about one of the important things about learning these data visualizations was like communicating these data points and these, I guess, KPIs and all this information to people that don't necessarily like understand the raw data is very complex. It takes a lot of like understanding what the user needs and putting that into a visual that they're gonna like understand and like tell a story with this data and say like, hey, these numbers are going this way. Why is it doing this? And kind of like forecasting for the future. So yeah, I very much enjoyed data visualization and that really helped me. Yeah, I think that's about it. There's definitely more. My brain is just like blanking on this right now.
That's okay. Thank you, Matt. Ishrath, would you like to go next? Oh, Schmidt. Or we can jump to Sarita if Ishrath isn't ready right now.
Sorry about that. Sorry about that. Sorry about that. So from what I've learned, like, I mean, I completely agree with Matt, like how he's saying about, getting the data and then the data which is collected and how the data is like further translated. From a clinical perspective, I understand that how much documentation goes in for each patient's chart, whether it's like a paper chart or an electronic health record, there's a lot of documentation. But what is important is, I mean, and what the degree helps you understand, or the course helps you understand is how the relevance of that, all the data which the physician has recorded or any clinician has recorded, how that data is then converted and how that can be actually utilized for the, not only for the benefit of the organization, but also for the patient, for the improvement of patient services as well. So I think this degree, it actually helps you understand, I mean, if you are interested in I mean, if you are good with systems, I mean, if you have an interest in healthcare systems, and if you are the kind of person who wants to actually learn, like, you know, I have put down so much of data in the patient's chart, and then what is actually what importance is this data now to the patient or to the organization? This program actually helps you understand that progression from the patient's chart to the next level. And also, like, I mean, with all that much of data which gets collected, and what I have seen is the importance of how the clinical data is for, as Matt had said, for, you know, for KPIs or for KPIs or for patient surveys, or for improvement of healthcare delivery, and for improvement of any facilities, health services. Whatever data you collect, you know, like what we do at the practice now, like whatever patient data, like patient survey data which we collect, it helps us in improving the services for the patient itself. I mean, that feedback is important. So I think from what I have learned from the program, I can now actually sit down with the clinicians, and then I can say that, look, I mean, what you have entered, it's, I mean, this is significant, but it does not actually translate into the correct data, which might be important for insurance filing or for claim submission. It might have some kind of like an issue because the data is not complete in this area. So that has given me, it has broadened my perspective in understanding. And I think that has also helped me in my communication with the clinicians and with my team members, be it the administrative team members or the clinical team members. So it has really helped me in broadening my horizon from my educational background, from my previous educational background. So I think definitely the HRM program, the MSHI program, it definitely does improve. I mean, if you are from a clinical background, it does help you in understanding the relevance of healthcare data and how HID fits into all this. Thank you.
Great, thank you, Ashrath. Sarita?
Yeah, so similar to what Matt and Isra said, I actually, from the HIM perspective, coding was a big thing. So understanding the medical codes, why I wasn't a physical coder in the insurance business, that's how they bill and get paid. So being able to understand those codes and how they're structured, how they come about, kind of the cycle of when they come in, things like that could help me translate that to the business and also IT to know for updates and things like that. So while I wasn't a coder, hats off to the coders, knowing that knowledge helped me with that component. I would say similar to Matt, legal, because knowing compliance, knowing all the legal things with contracts, I worked with provider contracts, so things like that, it definitely helped me with the legal aspect. And data at the time, we were using Access databases with Karen. So data structure and how databases are come together and organized and structured helped me build on my advanced data and informatics when I got into health informatics field. So that was a big component. And I would say the other two things that kind of bleed between both programs was the IT to business translation, as Isra just said, basically being able to be that translator to the business when IT is saying, I need this system process done and business or operations aren't understanding how to do that. So each of my fields I've been able to been a part of a system implementation, one for care management systems, not necessarily EHR, but those have been instrumental for me to be kind of that liaison because I could understand all the system components and then also understand the healthcare business as a whole to bridge that together and make that gap in between them work. And my last thing would be team projects and being able to lead those. So I definitely built on my leadership skills, being able to be in cohorts with the students and being able to work through an initiative together with different personalities, different feedback, different background. That has also been very collective and helpful in the work environment, being able to navigate through that because I was working through projects and just basically being able to use the strengths of each person and understanding how to recognize that. And that was definitely evident in both programs and our projects and things that we had to complete.
Great, thank you so much, Sarita. All right, our next question, which kind of, Sarita kind of led us into this. How did completing your program online benefit you? Do you want to start, Sarita, since you kind of left off on that note?
Yeah, definitely. So online, my bachelor's, the HIM was in person, but the master's was online with the health informatics. And that was very beneficial. Midway through the program, we actually moved to Washington State. So having an online program afforded me the opportunity to continue my degree without switching programs or stopping and starting all over again. So being able to be flexible online helped me even be in a different state with a different time zone, still meet my deadlines to be able to get through the goals and program initiatives and still collaborate with teams and things like that. It also, I would say, prepared us for kind of what we're in now. A lot of online meetings with work, a lot of online collaboration and other things. So being able to be a student and know how the online process works for school was an easy transition for the work environment to be able to do that. So I think it's a hand-in-hand skill that wasn't officially preparing us, but definitely made it easier and more flexible to be able to do that. And just being able to do things remotely has evolved, and I know it's here to stay. So.
Thank you, Sarita. Matt, you want to go next, please?
Sure. Just like Sarita, I did the bachelor's HIM program in person, which was great because you got to actually meet with people. But like the online master's program was the best convenience ever. Being able to like fully work and like still be able to like get experience in other areas while like taking classes online makes it just super convenient. Like Sarita said, like I could travel, I could do other things. The only thing you really have to make sure you do is just understand when deadlines are. And it just is great to be able to communicate with different people from around the world, really, to get their experience and understand like where they're from, and like discussion boards between them too.
Thanks, Matt. Ishrath?
Yeah, I completely agree with both Sarita and Matt. Like I think the biggest asset of the program is its online convenience, especially for like being a mother. I mean, it's so difficult to to actually attend like a full course like on campus. So and that's one of the reasons why I chose the UIC and master's program, because it was online, completely online. It really helped me in juggling my tasks as a mother and as at work, and then also completing my assignments. I mean, the whole thing was like pretty well, the course, any class you take, I mean, it's so well drafted, right? I mean, the deadlines, the calendar ahead of time, all the dates ahead of time. So for me being a mother, I mean, like I know like my, I can coordinate all the tasks with my kids and at home, as well as my assignment dates. So that was like one of the biggest thing. And I think if it wouldn't have been online, I wouldn't have been able to complete it. And in this time period, it would have been very difficult. And also like, I mean, I was like, starting school again after so many years. For me, I was very nervous because first of all, I did not do my schooling in US. So I was like completely new to the education system here. I'm a graduate from India. So for me, I was very nervous, like how I would be able to understand the education the whole process of communication here. And then especially being it online, I was still nervous about that. But I think because it was online and you were not face to face directly with other people, it kind of like gives you that scope to kind of like settle into your course. And then slowly, and I built up my own confidence, and then I knew what I was doing, and I had a lot of help with the professors. So it was very, very helpful for me being a mom, and from being a student who did not do the high school here or even did the bachelor's here. For me, it was like a new experience. But the online program definitely helped me. I mean, for mothers, well, I know for parents, for moms, like moms, dads who are actually juggling with so many different tasks, I definitely recommend. I mean, this program would be one of the best choices they would make.
Thank you. That's great to hear.
Yeah.
All right. Does anyone have any questions for the alumni panel before we move on to the financial aid section? You can come off mute. Don't be shy. Or you can send it in the chat if you're more comfortable with that. No questions as of now. All righty, we will move on then. All right, I'm going to introduce Bianca. She's with financial aid. Thanks for being here, Bianca.
Hi, how are you?
Good.
Thank you for having me. Okay, so next slide. So people that are interested in financial aid, you can apply for FAFSA. You just have to go to FAFSA.ed.gov in order to be considered for aid. The FAFSA is available October 1st of every year. So please make sure to submit your FAFSA every year if you're interested. Just make sure you submit your our school code, which is 001776. Once we receive your FAFSA, then it does take a couple of weeks to be awarded if we do not ask for additional documentation. But if we do ask for additional documentation, please submit it in as soon as possible. Sometimes it does take 4 to 6 weeks during our busy time, and during our low peak times, it's within 2 weeks. For students that are interested in the graduate program, you would only be eligible for student loans, and you must be at least 5 credit hours enrolled in order to be eligible for these student loans. Typically, a graduate student will be offered an unsubsidized loan and a graduate plus loan. And with that, you'll be offered loans up to your cost of attendance. Your cost of attendance will include tuition, fees, housing and food expenses, personal expenses, and that would be it. That would be part of your cost of attendance. As for undergraduates, we do suggest for you to submit your FAFSA as soon as possible because it is first come, first serve regarding grants. And this is for first bachelor degree students. If you have any questions regarding your financial aid, please make sure to contact us. You can email us at onlinefinaid@uic.edu, or you could give us a call. You can also visit our website, there's a lot of helpful information there. Just go to financialaid.uic.edu. Now, if you're interested in the program and if you're entering in the summer, just make sure you complete your 21-22 FAFSA. If you're coming in the fall, you would have to complete a 22-23 FAFSA. The next slide. So this is admission deadline. So this is more in your part, Dana, I think. Payment plans. Payment plans are handled by University Bursar. So if you are interested in a payment plan, the link is right there, paymybill.uillinois.edu. If you have any questions or having trouble in signing up for the payment plan, you can contact the billing office. If you visit the website, their contact information will be there as well. The next one, I think that's it. So if you have any other questions about financial aid, you can submit it in the chat box. I'll answer as much as I can. If you have any specific questions regarding your financial aid or anything else, you can always email our office. Thank you.
Thanks, Bianca. And then I do want to just backtrack really quick. We have our admissions deadlines here. There is a summer term for both master's programs. The application deadline for the summer is April 1st. However, we do encourage you to get them in sooner than that, just so we can make sure we have all your materials ready to go. And then the bachelor's in health information management, you can apply for the fall semester, and the deadline for that is July 1st. And then our fall application deadline is July 1st as well for the master's programs. And now we will move on to our Q&A part. If you have questions for the alumni panel or for Miriam or Karen or for Bianca, either you can come off mute or send them in the chat. I know I've seen some questions in the chat. It is being recorded, so you will all get an automatic email of the recording. Karima asked if this is a good career, if health informatics is a good career for someone who doesn't have any clinical background. Miriam, I think you answered that in the chat.
Yeah,
Would
and
you
I
like
can
to?
do that.
It
Sure.
does look like there's a couple other questions I might be able to answer. I see Deepa has asked about the prerequisites, and it all depends on how many classes you want to take. If you want to keep taking classes every semester, it's possible to complete the program, including the prerequisites, in 2 years. It's maybe a little ambitious to try to do that. It all depends on your own situation. And then I see Douglas is asking a question that's about certifications. We have some certifications now available in HI. I'm not sure if you were asking about HI or HIM, but we do have certifications in health data science, in consumer mobile health, and in leadership. So those concentrations are available, and you could earn those with your electives as part of your HI degree, your master's degree.
And I can piggyback off that for the coming from a non-clinical background as well. It's a very viable degree. And you don't have to come from a clinical background to be able to finish this, to get into the field at all. You just have to kind of have a passion for data and information, a little bit of technology, and you'll do just fine. Also, I completed the master's program in 2 years. Like Miriam said, it's a little ambitious, but if you want to get it done, it's totally doable.
And I can also add with the clinical. So even though I had family that have more healthcare, like medicine, pharmacy, and experience, I didn't have the direct clinical. But I would say with both of the programs, I've been able to talk to CMOs, chief medical officers, medical directors, nurses, and be able to understand their language because of the technology and all the information we learned about coding and all the other medical terminology and things like that. So definitely in the program, you'll get the experience and be able to at least know how to get in the ballpark of what they're saying, but still be in the room asking questions too if you don't know what it is. But at least in the program, you would at least have a starting point of understanding the clinical and what they're trying to get at and things like that. And for the HI program, I did the part-time as I was working. So I did 5 years in the program and I was able to pace myself just fine without an issue. So if you want to go the longer route, I did the 5-year.
I think there's a couple of questions in there for me. I'll jump in here. One, somebody was asking about, I think it was Barrera was asking about you wrote it as RAIH. I think you mean the RHIA exam. I did mention that it stands for Registered Health Information Administrator. It's a credential that is offered by the American Health Information Management Association. So it's a national certification, which demonstrates competency as you go out and enter the field. It's considered an entry-level credential, which means you're eligible to take it actually in the last term of your program. It doesn't require any experience beyond what you get in the program. So it's just another thing to say, I'm competent in this field, and it will open some doors for you on your first job. I believe both Matt and Sarita have received that credential, right? So maybe you can talk a little bit about what that did for you.
Yeah, definitely open doors. Getting right out of college, that was a good thing to have right away. I took it, I think, a month after graduating. So that was pushed for the program, get it right away. And that was a good differentiator when people were looking for resumes. The credential was in job description. So I could say I had that. So it was a good way in the door for sure.
And again, that is one of the differentiators between the health informatics and health information management that I just wanted to clarify. You have to be a graduate of a CAHIM Health Information Management program, CAHIM accredited program. And the health information, it's geared for students in health information management.
Yeah, like Sarita said, definitely helped get my resume to the top. There are also several companies that didn't even know what that was, but interested in them that this was even a credential, and like still put me up there as well, to just the fact that I have a credential and information regarding healthcare, like really makes you stand out.
And I see someone else has asked a question. I've heard the deadline, Natalia, I think I've heard the deadline for the BS is May 16th. No, for the online program, it's July 1st. That is for the campus program.
Thank you, Karen and Miriam.
I had a question for
Oh
the
yeah, go ahead.
My question was, why did they choose to for their masters? Why did they choose HI and not HIM, or was it not there when they were like pursuing it? Or
So for me, I think the Masters in Health Information Management is a fairly new program within like the last 2 years. I think Karen can confirm that.
Yeah, it was 2020 we enrolled our first students. And it is basically the same material, but at a slightly higher level that you get in the bachelor's degree. So you wouldn't do the bachelor's in HIM and master's in HIM. You do one or the other. The health informatics is more of a natural continuum then for those that have an undergraduate degree in health information management. It's different content. Again, whereas HIM focuses more on the data and what you do with it as far as coding and collecting it and keeping it private and protected and all that. I mean, health informatics is a broader focus. I don't know, Miriam, you might, again, we get that question a lot. So Miriam, you might want to do your take on how it differs too.
Health informatics is a very broad field, and there's clinical informatics, public health informatics. That's part of the reason why we have created concentrations to kind of help students pick the area that's of most interest to them and that they can see themselves working in. So they might, as we've heard Matt talk about, and work in the area of health data science. We might have somebody that really wants to work in leadership, or we might have somebody that's really interested in telehealth and mobile health. So I think that there's a lot of different directions you can take health informatics, and that's part of its appeal. Like Karen said, it's very broad, and there's a lot of different opportunities.
Hi, I just wanted to reply back to Deepa. I saw a message from Deepa saying that she's also a physician from India, and she just wants to know about if the program requires a lot of technical knowledge. Deepa, I can tell you that if you are able to use, like you use computer, like in general, like, use Word document, use Excel, use the basic MS Office applications. If you're able to at least use that, create a document, save a document, do at least that. And if you're able to log into a program, have a user ID, log into a program, and create assignments on your laptop, if you're able to do that, then you really don't need to know too much. I mean, as I said, even I was very nervous when I first started because I didn't know for some of the courses. I thought it would be too technical, and I kept on asking my professor. I was bothering my brothers who were in IT. I was like, you guys really have to kind of guide me, because what if I get stuck in one of the courses? So anyways, but then I really did not have to take help from the family at all in understanding any of my lessons. I mean, I was able to coordinate with the professor, and as I said, I mean, you can do it. I mean, if you have those basic IT skills to kind of log in, use MS Word, Excel, you should be fine. I mean, there's not that much of a math. I don't think the courses which I have taken had that much of a math. I did not pursue the data science concentration. I did not do that because I was interested more in consumer informatics and the whole overall perspective. I did not go into any concentration. So the classes I took, I did not require any intense statistics or things like that. And with the help of the professors, you will be able to do it. Trust me, you'll be able to do it. If you have that, you already have the clinical background, and you have an understanding of patient experience and what kind of clinicians or document and things like that. You just need to get some understanding of how the health information system works, how an EHR works. Basically, if you have that understanding or that experience, that would actually help you in with the course. That's what I feel. I had a lot of experience with EHR and with HIT from my previous workplaces. So that actually helped me a lot. I mean, for you, if you're planning to do the MSHI program, I would suggest that you do some kind of like an internship, or some kind of a volunteering at a facility or at a doctor's office, which allows you to use the HID system there, the EHR there. That would give you the leverage to understand the whole to understand the way the system works here, the healthcare system works here, and how patient information is recorded and used, and how reports are generated. It will help you a lot, especially with the program. Thank you.
Yeah, I'll have to echo that as well. I did do the health data science concentration. And even then, the professors are great in teaching you the basics and the ground foundation of statistics, and working with Tableau dashboards, like I said, working with a little bit of coding and data analytics programs. They give you that base foundation, and they're really great with making sure you understand it. But the greatness of the health informatics program is that they have these different concentrations that if you're just not a statistics person, you can go into mobile health concentration now in telehealth, or work with EHRs and the technology side instead of actual statistics. So yeah, that's why the health informatics field is such a broad spectrum, that you can kind of just figure out what you like and master that.
And I would add just in the mastering that. So even though you have your degree, don't stop learning. You can get through associations, you can get through other classes or other certifications. So continue to make yourself shine in the field and keep that concentration and learning going, because that will continue to make you more marketable going forward.
Don't be afraid to try something new either. Like that's the great about schooling, is that you can take a course and still do it, maybe not like it, but at least you figure out that you don't like it now, and then starting a career in it and going forward from that.
Great, thank you everyone so much. Well, we've got about 1 minute left. I want to be respectful of everyone's time. So if we were unable to get to your question, please feel free to reach out to me. Again, my name is Dana or Curtis Adams. I know we've been working with a lot of you already, but we can be reached at onlineinfo@uic.edu, or you can reach out to us over the phone at 866-772-2268, and we will be sure to answer all your questions. Thank you to everyone who joined us. Thank you to the alumni and Miriam and Karen for taking time out of your day. I hope everyone has a great rest of their day. Thank you.
Thank you.
Thanks, Dana.
Thank
Bye.
you. Bye.